County leaders are taking action against opioid overdoses across county communities. Tonight, County Council approved to use over $400,000 from the South Carolina Opioid Recovery Fund toward new strategies. Our Tiana Maxwell spoke to leaders to tell us why they're now pushing for more resources.
More resources is part of the county's efforts in lowering the number of opioid overdoses. And while leaders with the county coroner's office say that they're seeing less overdose deaths this year than they did last year, they say even one death is too many. So far this year, the Dorchester County Coroner's Office recorded 9 overdoses. It's a decrease from the 24 recorded overdose deaths from January to the last week of July last year. Leaders with the Coroner's Office say expanding their resources for opioid use disorder is a part of the reason behind the decline in numbers.
The opioid crisis is caused by a lot of things. It affects people for many different reasons. Therefore, we have to have a lot of different approaches ready and resources to be able to meet those needs and to combat everything that goes into that.
That's why county leaders are using just over $446,000 from the South Carolina Opioid Recovery Fund, or SCORF, for opioid overdose prevention resources. The measures fall under the county's Community Overdose Response Plan, including peer support and the Leave Behind program that offers resources for family members left behind after an overdose. Another part of the plan is creating what's called community paramedics.
Community paramedic will be able to see, like, oh, this person experienced an overdose, or they need some more follow-up, or maybe they're an at-risk person in Dorchester County of an overdose. They'll be able to respond in person and offer to come out and visit them.
The extra dollars are also going towards creating Narcan distribution centers. The opioid overdose reversal drug will be available for distribution at the county's Alcohol and Drug Commission, Emergency Medical Services, and the coroner's office, which County Coroner Paul Brothers says can be life-saving.
If you know somebody that is habitually or regularly using drugs that have opiates or opioids in them, then it's a good idea to have it on hand nearby just in case.
Brothers says keeping the drug on hand is not only a resource for users, but also loved ones.
It's good to have it in that environment because there'll be unsuspecting people who could be exposed to fentanyl dust and other particulates in the air that could cause an overdose.
Commission leaders tell me that they already have the funds, but with County Council approval, they're planning to use those funds towards projects as soon as possible. Reporting in Somerville, Tiana Maxwell, Live 5 News.